Welcome to Los Robles. I'm Dr. Edward Evans. I'm the medical director of our neonatal intensive care unit. It's very important to deliver at a hospital with a neonatal intensive care unit. Although most babies, fortunately, are very healthy, you can't predict when one won't be. And that is why we are here with staff that will be either at your delivery or called if necessary if something unexpected happens. Different hospitals have different levels of neonatal intensive care. Here at Los Robles, we're fortunate to have a level 3 NICU. We have the equipment to take care of the babies that are the smallest and most premature here. We take babies down to 23 weeks gestational age. Level 3 NICUs means that we can ventilate babies on a breathing machine, and we can do that for an extended period of time, as long as is necessary. It's never our hope to require mechanical ventilation, but here at Los Robles we are able to perform that, especially for babies that are born extremely premature. We also are fortunate to have respiratory therapists, which are specially trained in taking care of small babies. These specialists know the best way to take care of the breathing machines and the other types of respiratory support that we offer, from oxygen to CPAP and beyond. We also have occupational therapists, which will help babies learn to eat and can help stabilize so that we can get babies onto feeding and growing, which takes care of many of the concerns of prematurity. We really like to emphasize family care and kangaroo care, which means we like to have your baby on your chest as much as possible. We have a wonderful tool called NICView. After you are discharged as a mother, sometimes baby has to stay beyond the time that you're able to stay. At many NICUs, that means saying goodbye to your baby. But here at Los Robles, we are able to see the babies through this NICView program. So through streaming secure video, you can follow your baby's progress as they grow. This allows you to see your baby 24 hours a day at your convenience over your phone or desktop. The day arrives when we are fortunate enough to celebrate going home with you. At this juncture, we really need to make sure that we tie everything together for continued care. We're fortunate enough in the community to have many wonderful pediatricians, and we know them well and help to transition from being in the hospital to being at home so that we can maximize successes at home as well. With a personal relationship with your pediatrician, we're able to continue this after you go home. We discuss things about ongoing diet, things to maximize development, and when we'll see you back in our follow-up clinic as well, so that we can participate in your milestones with you. One of the great things about a community NICU like ours is that we are here in the community, and we're part of the community. We've been fortunate enough to have multiple reunions where we're able to get together, and this is a great chance for us to catch up. Many of the nurses and us as well continue to follow your children as they get older and see those great Facebook pictures. And fortunately, some people have been nice enough to continue to write us letters so that we can find out what's going on. Beyond that, we also have a NICU follow-up clinic that continues to follow children as they get beyond their due date, up until 3 years of age and beyond. This lets us follow what's happening with your family, and we are fortunate enough to be present in many families. As a father, I know how important the care of your children is. I have 3 girls of my own, all of which were born in hospitals with neonatal intensive care units. Fortunately, none of my children needed neonatal intensive care, However, I deal with families every day that do. We are here to help and to be with you during this trying time.